For us to say a woman is menopaused, we need to have this woman have no period for 12 months. If you have no menstrual cycle for 12 months, we look back and we say it's menopause. That is if you are between 45 and 55. Some may have premature menopause as early as 30, 35. That needs to be investigated. So if your period is absent for that period of time, you need to come see a doctor and be investigated. So from 45 to 50, average age of menopause in Zimbabwe is 51. So before, if it happens early by 40, you're not seeing your periods, you're experiencing hot flashes, you may need to have a workout. You come to the doctor and then we see what is wrong with you. So why is it important for us to understand our bodies in line with our physiological process? It has got so many sides to it, so many facets to it. One, psychological, emotional side of things. You may just realize all of a sudden you're no longer happy, you're no longer liking the things that you used to like, and you are popotera and left, right, and center for no reason. And just not happy. And then just look at your reproductive clock. You may realize that you are probably 45 and above. Some will start experiencing hot flashes. Hot flashes, it's as if you're being fanned by a steamer. Thank you. It's as if you're being fanned by a steamer and you're sweating, or you just have this sweat from nowhere, and then so it's a normal process and we should celebrate it. Therefore, this is why we are talking about it. When you start noticing these changes, you then need to start wearing light clothes. You can sleep with a fan on. You can change your bed linen to favor whatever it is that you are going through. You can also embrace showering before going to bed. It helps a lot. The most important thing about menopause that we really need to appreciate is the fact that when you start menopausing, it means your estrogen hormones are coming down. Your ovarian reserve is depleting, but we need estrogen for the moisturization of our important organ. So you may start to experience dryness and pain during intimacy. When that happens, there is help out there. You can get estrogen creams, they can help. You can use other forms of lubrication to maintain your conjugal duties. Being menopausal and still maintaining your conjugal responsibilities will not cause you to have a pot belly. Because people think when you have your period, you're washing away all the dirt. It's not dirt, by the way, it's just food for your womb, it's protein, so it's not much. Most of it comes out anyway. So after menopause, you can still continue to enjoy your conjugal responsibilities, but if there is pain and discomfort, help is there. But most importantly, when your estrogen levels are low, your bones go through what we call osteoporosis, and they become weak and brittle, which is why anagogo sometimes unoti vachikoka, and you're wondering kuti vatanga vachikoka vakadona ere kana kuti vazombodona vakachikoka. When then you go and do an x-ray, the bones are osteoporotic and are very light. So to avoid that, we may get some supplements depending on what your symptoms are. You may get nutritional supplements. If the symptoms of hot flashes are bad and you cannot function, you can get hormone replacement therapy. There are hormone replacement therapies out there that you can get. However, some studies that were done at some point showed that overuse of hormone replacement therapy may predispose you to breast cancer. So whatever you do, do it with your doctor. It's supposed to come and go, the hot flashes and stuff, but sometimes they do stay for a while. That's where you need to do some life changes. modifications that can also help. And if you are feeling low, if you've got a foggy brain, there is help out there. Psychiatrists, doctors, talk to someone. Help is available out there. And I think as far as menopause is concerned, the mood and the bones and the conjugal responsibilities, those are the three things that I thought I would emphasize, that life has to be normal.
Thank you, Dr. J. Conjugal responsibilities. Don't forget, Dr. J, you can go to Eden Hospital, you can also call a, just a nudge, you know what I mean? Don't worry about that, she's here. Questions? Yes, ma'am.
Thank you for the opportunity. I would want to inquire about supplements. At what point do you start taking supplements, like especially for when you're getting to those ages that you're talking about, and which supplements are helpful, because you hear about magnesium, the vitamin D that you're talking about, probiotics, which ones are recommended when you are getting towards those ages?
Okay, thank you very much. So supplements are usually artificial things that we're getting into our bodies. And suffice to say, sugar beans, soya beans, soya chunks, they are very rich in natural estrogens. So that's why my chunks is VIH, because they will provide you with available natural estrogens, and some of them they will not even have problems. And after menopause, there is no need to continue with family planning. So you want to have a bone density assessment, probably, because when the hormones up to 62 years, you still be having residual hormones, estrogen in you, but they'll be declining. So I would say maybe you consider taking supplements after 62 years. But then in between, people are different. You can have a bone density assessment, which might come up pricey, but I'm sure some medical aid packages cover it. You can have that, and then that might also help you. But natural foods which are rich, we can look them up. Things like lentils, even our sugar beans.
Thank you very much. Questions? Dr. J, I'm going to ask you a question as I walk to the lady. What is the youngest age that someone experiences menopause? And also, am I going to fall pregnant at the age of 52?
Okay, thank you very much. So youngest age, like I said, there are people who go through premature menopause. When you go through premature menopause, you miss your period, you come to the doctor, we look for a follicle stimulating hormone and a luteinizing hormone, we realize they are above 30. If that is the case, then to premature ovarian failure. However, there is a condition called polycystic ovarian syndrome, where you can miss your period and it's not menopause. So whenever you are missing your periods, before you conclude that it's menopause, you have it confirmed, because you may actually fall pregnant unplanned. And yeah, so at the age of 52, you may actually fall pregnant because there is a decline in ovarian reserve, especially if you're still seeing your menses, if you're still having your periods, because we say the upper limit is 55, so by 52, you may actually be having residual ovarian function, and you may end up getting pregnant. So it's important to have menopause confirmed.
Thank you. All the ladies who are excited to reach menopause to give birth at 52. Hands up, please.
That was my question. Oh, that was the question.
Oh, lovely, lovely, lovely. All right then, let me rush to you.
Okay, if I'm having maybe terrible meds or periods, right? And I feel I don't want to go on my periods anymore, can I get assistance, or can I get a pill or injection or something just to stop them?
Your periods, very painful periods. Yes, such things are there. You can get, it can keep you dry for 3 months, and it's okay to do that. When you intentionally stop your period, it's okay, it will not harm you in any way. Some will say to increase your appetite, but it's all about what you eat. that will make you gain weight, not the virtue of having the depo in you. So yes, you can do that. However, it be treated. So you may also want to see a doctor to help you. Some are a result of fibroids, which can have other consequences. Others are a result of endometriosis, which you can get medication from. But definitely you can get your periods. That also speaks to some women who will have functions and they're taking birth control pills, the combined oral contraceptive. It's okay to skip the brown ones for maybe 3 months, and then you take the brown ones. Taking the brown ones will not make you bleed, but what will make you bleed is when you've stopped taking the white ones. But you can't continue taking them for the whole year. You need to bleed 3 times a year to protect your endometrial lining.
Oh, it's a new thing for us. Thank you very much, Dr. J. Still looking fine. I would like to say that Dr. J also sits on the board of BBW. Beautiful black. Got another gentleman who's here with his lady. Ah, come on. Please give the gentleman a round of applause as he comes through. My major stakeholders, I'm honored to get into this part of our session. I'm going to ask Linda to introduce our keynote speaker. And so, Linda, over to you.
Thank you very much.